Hello. So today I will be talking about alcohol use disorder. And we're going to start off by first unpacking the DSM 5 diagnostic criteria for alcohol use disorder. So the next few slides will list several factors or symptoms that need to be present for somebody to be diagnosed. And I'm going to go over several of them. So, criteria A is specifying that there must be clinically significant impairment or distress that's manifested by at least two of the following symptoms that I have outlined in this slide and next. And some of these symptoms is drinking larger amounts for longer periods of time than a person intends, a persistent desire to stop or unsuccessful efforts to stop or slow down. Also, excessive time spent trying to obtain alcohol or using alcohol and getting so intoxicated that it's taking time to recover from the effects of it. And then cravings, strong cravings. And the main symptoms also are impairments in relationships, in interpersonal problems at work, at home. So these are pretty significant symptoms that, again, impair one's functioning, therefore, can be considered an alcohol use disorder diagnostic criteria if there is two or more. Some additional ones are, again, social, recreational, or occupational impairments in functioning, and then continual alcohol use, even if it's physically hazardous for somebody to use, like perhaps even drinking and driving could be part of that. And then continual use despite getting sick physically or mentally. And then greater tolerance for the drug, for alcohol in this case, and then having withdrawal symptoms. So the severity in the DSM for alcohol use disorder is identified by either mild, moderate, or severe. And as the slide indicates, having two or three of the symptoms we just went over is considered mild. Moderate is about 4 to 5, and then severe is more than 6. Prevalence of alcohol use. Alcohol is used in every society known to man. It has been part of everyone's culture to varying degrees, and a lot of times, like the culture I'm from, Serbia, it is used as a celebratory component of any, weddings or funerals or any cultural, communal parties or connections where people gather together. So alcohol is definitely a prevalent substance in the United States as well. And our current statistics show that, again, because of its ability to be purchased easily, even if there is a age criteria, alcohol is pretty easily accessible to most people, and it can be pretty affordable. So the likelihood of somebody developing a dependence or unhealthy use of it is significantly high. And the numbers show it for the US. So about 29.5 million adults and adolescents actually meet criteria. So they have at least two of those symptoms or more. And this is annually. So these are annual figures that are staggering. They're quite high. The highest prevalence is among the 18 to 25. So it's the late high school, college kids or adults that do have the highest rates of developing a disorder. And in individuals that are stressed out with PTSD, trauma, mental health, or just experiencing really intense pervasive stress. And then people that have a family history of substance use also can have a greater propensity to develop an actual condition. So, impact of alcohol across diverse populations. So, there are several categories that I would like to go over. Racial and ethnic differences. So, we have similar or even lower prevalence among some minority groups as far as alcohol dependence or unhealthy use, but there is greater health consequences. So even if the numbers are similar to the main population or sometimes even lower, the actual ramifications of health conditions can be quite negative and detrimental to the minority groups. They don't have, on average, the quality medical care that perhaps the larger society has. And so that's one of the factors. A particular example is Native Americans. They've always had difficulty with alcohol use, and there's some research that talks about alcohol being used as a coping tool to combat all of the PTSD from generational trauma and oppression that that group has experienced. And so they do generally have very high rates of alcoholism and actually high mortality rates due to alcoholism. And then Latinx and Black communities experience more stigma regarding addiction, so that also prevents their ability to seek out help, quality help, and there's fewer treatment resources, and all of that contributes to worsening outcomes. And gender differences. So men have higher rates of alcohol dependence as compared to women. And then women experience more medical conditions and complications and a faster progression towards addiction to alcohol than men. Some health outcomes. So, obviously, alcoholism or any sort of unhealthy use of alcohol can have higher rates of liver disease, can cause cancer, cardiovascular conditions, also premature deaths and accidents, car accidents in particular. And it is a leading cause of preventable death globally. So I find that interesting that if every individual stopped using alcohol excessively, the ones that are using it excessively, we would have significantly lower death rates globally. So, very fascinating. And socioeconomic and environmental factors, obviously, poverty, housing complications, unemployment, all increase rates of alcohol use and dependence. Social isolation, and then particularly among the elderly, can contribute to misuse, overuse, and even getting underdiagnosed, since a lot of the elderly are not really screened appropriately for addictions. And there's just this assumption that they wouldn't have addictions, and in fact, they do. And common screening instruments, so psychological assessment tools that are used to screen, I list three main ones that are being used currently. Audit, so alcohol use disorder identification test is the main measure, so it's considered a gold standard. And it screens for misuse, for hazardous use, and for dependence. And we also have ASSIST, alcohol, smoking, and substance involvement screening test. And that is looking at multiple substances. So it's assessing for several different illicit drugs, including alcohol and tobacco. And then we have the TAPS, tobacco, alcohol, prescription, medication, and substance use tool. And that's primarily used, it's a shorter screener used at primary care physician offices. This screens and looks for substance use conditions. Some psychological assessments that can be used to identify if someone has difficulty with alcohol or drugs would be the structural clinical interview and the DSM. And that's a formal diagnostic interview for substance use disorder. It's, again, a gold standard and quite easy to use. Then we have the Addiction Severity Index that looks at several domains of one's functioning, which includes interpersonal, medical, family, legal. And so that's a really good one to use as well. And then we have the substance abuse subtle screening inventory, which really is like its name. It applies to subtle items and subtle questions to identify if there's a high probability for substance use. Some factors that impact selection of assessment tools would be one category is client centered considerations, right? So we want to make sure that we consider someone's age and use the correct tools because different ages require different tools. And we have to, as clinicians, ensure that we're using appropriate assessment tools for the age of the client. Clients' cognitive capacity to provide informed consent, to participate, and to be able to really understand the assessment tool and be able to, again, answer accordingly is very important. That also kind of falls into the cultural and linguistic appropriateness. So making sure that the measure is normed for the patient and is mindful of the culture and also the language. Are they able to really answer the questions in the language that it's being asked? And then also considering someone's health understanding in general and the idea of wellness and their comprehension of that and even exposure to wellness and health proactively. And their educational background is important. And then comorbidities, if they have a dual diagnosis, so if they have psychiatric and medical conditions, will also guide and gauge which assessment tools would be used. Clinical and ethical factors that impact selection of assessment tools is, what's the reason for the assessment? Is it going to be used just as a screener? Is it to clarify a diagnosis, or is it going to be used for treatment planning? Also, the setting that the clinician and the client are at. Is it a hospital where there's more time to do an assessment oftentimes, or a partial hospital program or intensive outpatient? Or is it a 1 hour primary care visit where a shorter screener needs to be used? And that falls in line with how much time is there to engage in a comprehensive screening versus brief. Also, cost. Is there a cost? How easy is it to administer, or does a patient need to pay out of pocket? And that obviously is going to impact their desire or ability to engage in a psychological assessment or screener. And then what's the training required for the administration of the test being used? The cultural appropriateness and bias consideration, so ensuring that the test is really neutral, that it's normed appropriately, and that it is the best suited test for the client, considering their cultural and linguistic identifications. And in confidentiality and informed consent, ensuring that the test is confidential to the patient and the psychologist or the medical practitioner, and that there is informed consent so that the patient is really verbalizing understanding in engaging and participating in the test. Cultural humility and why it's important. So in our class and throughout the program, we have been really immersed in, and I'm very glad we have been, in this idea of culturally attuned care and making sure we're meeting the person in their environment. And so it's no different when it comes to substance use conditions and assessment and treatment for individuals that struggle with substance use. And so cultural humility is essential. That requires a therapist or a psychologist to have ongoing self-reflection to make sure that we are examining any values or assumptions or biases we have that can get in the way of providing patient-centered care. Also collaboration, understanding that assessment is not done to the patient, but that actually the patient is the collaborating person, and that it's done in conjunction or with the patient. Respect for differing worldviews and how addiction and treatment are viewed differently in different cultures. So being mindful of that and ensuring that that is explored with the client and that there's an understanding of their culture and their understanding of addiction and treatment. And then avoiding assumptions, so not pathologizing culturally appropriate practices. For example, me being from Serbia, weddings typically last 3 to 4 days, and there's a lot of alcohol involved. And maybe to some Western cultures in particular, that might seem excessive, like 3 to 4 days of nonstop drinking. However, for the Serbian culture, it's completely appropriate, and many of those individuals don't have an addiction or dependence. It's part of, again, the celebration. So understanding that would be very important. And then this idea that client is the expert. So gaining clients' views on substance use and recovery and incorporating that as much as it's appropriate in clinical treatment. And in the idea of a power awareness, recognizing that there is this power differential between the clinician and the client, and exploring that with the client, unpacking that, and checking in with the client and making sure that they understand that this is a collaborative stance as opposed to this power differential that is unfortunately present just due to the nature of that encounter of a licensed psychologist, for instance, and a client seeking treatment. Some cultural factors that influence alcohol use assessment would be beliefs about substance use, right? So cultural norms around alcohol use, how is addiction viewed, from a client's perspective? Is it moral, spiritual, or a disease? And also how it's viewed from the therapist or the psychologist's perspective. The help-seeking patterns. So, is a client preferring for family to be involved or community, or are they wanting to do this individually? And then stigma. Is there stigma attached to using? In particular cultures, there's greater stigma. And then also distrust of medical professionals. Is a client conditioned to go to somebody professionally to get help, or are they more opt to go to a spiritual healer, for example? Another cultural factor that influences the assessment is acculturation and immigration. So we know that, immigration can be very stressful. I'm an immigrant, and the process is extremely stressful. And so just this idea of acculturating and abandoning the primary culture essentially to merge to the mainstream can be a stressful situation. So being understanding of that, and the use of substances to cope with that, including maybe immigration problems that we know many people experience in the US now with what's happening with mass deportations. And then socioeconomic and structural factors. So access to culturally mindful healthcare and adequate insurance, is that the reality for the patient or not? Many times, minorities, generally speaking, don't have access to quality healthcare. They don't have substantial insurance that can cover adequate treatment. So that's an important factor when we're considering assessment. And then also one's immediate neighborhood environment. Is there high poverty or crime or access to alcohol, or even is there greater sort of advertisements of using alcohol to cope? We know that in poverty-stricken neighborhoods, alcohol and smoking are very much more advertised and highly glorified. So considering that and how that could impede on someone's willingness to maybe seek treatment. And in transportation, can someone get to medical appointments, right? Do they have childcare, or are there any financial barriers that impact their ability to seek help? And that is the conclusion of my presentation today, and the rest are just references that I used for this PowerPoint presentation. So thank you very much.